Hello and welcome. You're watching our special show, Coronavirus Facts versus Myths. I'm Gargi Rawat. This is the show where we get you all the latest on the pandemic. Up ahead, you can also call in with any questions that you may have. The number there on your screens, and doctors will answer your questions, so do call in. Well, first, let's take a look at India's latest numbers. And India's COVID case count rose to over 2.75 crore as 1.86 lakh more tested positive in a day. Now, this is the lowest daily rise in 44 days. The steady dip comes as scientists are studying if the B1617 strain of COVID is behind the surge in the cases in the last 2 months. Now, the positivity rate has come down somewhat to 9%, but it's still very high. Remember, the positivity rate has to be brought down lower than 5%. Vaccinations in the last 24 hours are 29,19,699, but that's still a very low. Experts say we must be vaccinating at least 80 lakh a day if we're to cover any amount, a good proportion of our population. Well, now the first big focus on the show, a promising new therapy for COVID on the horizon. Recent research published in the Lancet Respiratory Medicine Journal revealed that interferon lambda is among the first antiviral therapies to show benefit among outpatients with COVID, and that it accelerated viral clearance. To date, only monoclonal antibodies have been shown to be effective for outpatients with COVID. Interferon lambda is a type 3 interferon, and the study was carried out in Toronto, Canada, to investigate the safety and efficacy of the treatment of outpatients with mild to moderate COVID. It was found to be very promising and safe. Stage 3 trials are currently underway. Well, to talk more about this, we're joined now by Dr. Jeffrey S. Glenn, Professor of Medicine, Stanford Hospital and Clinics. Thank you so much for joining us to speak about this promising new therapy.
Yes, it's very promising, but just I want to preface my remarks by saying, for purposes of full disclosure, I'm a professor of medicine, microbiology, and immunology at Stanford. I'm also the founder and on the board of directors of Eiger Biopharmaceuticals, the company that's developing interferon lambda for hepatitis delta virus, the worst form of human viral hepatitis. And so, but I'm speaking to you today not as a representative of Stanford or of Eiger Biopharmaceuticals, but expressing my personal opinions as a physician scientist who works on virology and new antiviral therapies.
All right, well, thank you so much for stating all that up front. So please tell us about this therapy, interferon lambda, as a treatment for COVID. Just how promising does it appear to be?
Yeah, so interferon lambda is the body's first line of defense against viruses. And it's very effective at shutting down infection early on. And we know this in many other viral diseases, and it's in particular other diseases like influenza that actually kill people by exacerbating our inflammatory response to viruses. And interferon lambda is a very unique interferon because it has very potent antiviral responses without exacerbating all that inflammation. And that's why it's the perfect drug, I believe, for this particular virus, because this virus needs to be stopped in its tracks, and it also has to be prevented from turning on this overreactive immune system, which is what kills people. So the study in Toronto did a very rigorous, randomized, placebo-controlled study of patients who were newly diagnosed with COVID, outpatients, and gave half of them interferon lambda and half of them placebo. Interferon lambda is very convenient. It's a single dose shot given subcutaneously, just like people take insulin. And the results were pretty spectacular. First of all, from a safety standpoint, the physicians couldn't tell who was on drug, who was on placebo. And that's consistent with our experience with this drug. This drug is not yet approved, but it's been given to over 3,000 patients in the context of over 20 clinical trials, the last 4 of which I helped design. So we know it has a very well-characterized safety and tolerability profile. It's phase 3 ready for delta hepatitis. That registration study is about to start. But when COVID came, it was obvious that this would be a great drug for COVID. And what we found, a dramatic reduction in the level of virus in the COVID patients who got a single dose of interferon lambda versus placebo. And in fact, the drop in virus indicates that lambda is the most potent antiviral therapeutic that I've seen described to date. in terms of how effective it can drop the virus after a single dose.
All right, so that's interesting. It's a therapy that's been repurposed for COVID. So if you could tell us, what stage are the studies and trials at currently? Are the data recently published in the Lancet?
Well, so the data is out there, scientifically published in a top journal. It's very clear how effective this works. In terms of regulatory pathway, a phase 3 registration study is about to begin in Brazil, where there's a very large pandemic, devastation happening also. The good thing about interferon lambda is, unlike monoclonal antibodies, it is not going to be susceptible to mutations that are resistant to the virus or resistant to the monoclonals, because it acts in a very different way. So all these resistant variants should be equally sensitive to lambda. And so I believe it could have a tremendous impact when it's available.
All right, so you just mentioned about variants of COVID, and that is a big worry. So will this particular therapy work against, other variants that may emerge?
Absolutely. And the other advantage, of course, a vaccine is great to roll out, but vaccines take a while to become effective. And interferon lambda can protect people right away. Moreover, if there is a vaccine-resistant variant, interferon lambda can treat it just as well as regular virus. And so that's why I think this is a really important component of our response to this virus. It's a therapeutic, but it's very convenient. It's given easily as an outpatient. It doesn't have to be given like the monoclonals intravenously. So I think it will be, it's the best option. If my parents got sick with COVID, this is what I would want to give them.
All right, so that's a vote of confidence there. But many would point out, you spoke about vaccines, how now there are many vaccines in the market. Do we still need these therapies? Because most say that vaccines is the way to go to prevent the disease. Of course, if you talk about here in India, currently our vaccine drive is going very slow. But what would you say to that?
Yeah, so we need both. Of course, vaccines are great. For people who don't yet have a vaccine, though, and they get sick, the vaccine isn't going to help them. If heaven forbid a vaccine variant emerges that makes the vaccine useless, then the vaccine is not going to help them. So, and when people are already sick in the hospital, the vaccine is not going to help them. So, and not everybody takes the vaccine, even when it is available, even in this country. And so there's still a big need for a therapeutic that's safe, effective, convenient, and can be widely distributed. And I think that's where lambda fits in beautifully. Of course, it's good for many other indications, but clearly for COVID, to give you a sense, the monoclonal antibodies that have been approved, when you take them, they drop the virus what's called 0.3 logs after 7 days, okay? A dose of lambda will drop the virus 2.4 logs after 7 days. That's a log scale, so that means lambda is 100-fold more potent than the antibodies. So to give you an idea of the magnitude. And it doesn't have to be given intravenously. And again, we have a great safety and tolerability database in patients to give us confidence that this could have a huge impact.
Well, monoclonal antibodies are now available in India. They became available just this week, in fact. But as far as this interferon treatment goes, it seems it's still a long way to go before we can access it.
That depends how long the regulatory and red tape pathway is. As a scientist, the data is there. It's a question of, moving through the process. That's correct.
All right, Professor Glenn, thank you so much for speaking to us here at NDTV. Now, the other focus on the show is vaccines and the question of how long vaccine protection lasts. 2 new preliminary studies have found that immunity to coronavirus lasts at least a year and probably much longer and improves over time, especially after vaccination. The issue of immunity, remember, is something that is much debated, and vaccine protection. Now, together, these studies suggest that most people who have recovered from COVID and who are later immunized will not need any boosters. Vaccinated people who were never infected most likely will need a booster shot. Well, to talk more about this entire issue and what it means, we're now joined by Dr. Rachna Kucheria, public health physician, epidemiologist, and Dr. Giridhar Babu, Professor, Head Life Course, Epidemiology, PHFI, Bengaluru. Thank you so much, doctors, for joining us. Dr. Babu, first to you, what is your view on these findings? And I'm sure, of course, this is not the last we've heard on this issue of vaccines and how long the protection will last.
Yeah, thanks, Gagi, for having me on the show. So there are two things that these studies indicate. First, for those who are already infected with COVID-19 infection earlier, there is this bone marrow cells which have the memory to be able to mount an immune response whenever there is the wild virus. This is in resting phase till such a time when it is required. So that's what one study has shown. In another study, what they indicate is in terms of those who already had an infection and they're also vaccinated, then the efficacy is even greater, which is both good news. But in terms of how long the protection lasts, we are learning as we are moving with the COVID-19 pandemics. Definitely vaccine helps. Vaccine helps in both unvaccinated and also those who have had infection in the past. So that's a good news, Gagi. That's I can say as initial remarks.
All right, Dr. Kucheria, the interesting point is, how it differentiates about people who've had the infection and then get vaccinated and how they will have protection for much longer. And I'm interested here because I'm one such person. I've had the infection. I did get the vaccine. Of course, I'm waiting for my second dose. But so the immunity could last a lot longer than, earlier what was being predicted.
Right. And thank you for having me as well. This is what this early data, a couple of studies are suggesting. It's very early. They're surmising right now. We have to be very careful with the words that we use. And certainly even before, this study, we do know this, that an infection generally will give you a more holistic, robust immune response, as well as the memory B cells that were tracked in this particular study. And it was good that they did it. They found, proof all over again. And you rightly said that those people who had the infection and then went ahead to get that one vaccination shot had a very good immune response versus those who just had two vaccines. And I wouldn't say they clearly state that they are not right now able to say, the two are different. One can't say one is better or the other. The two are different. Certainly you get a good response, immune response for two vaccinations, and it is different from the person who got the actual disease and then got the vaccine, for sure. But early days, and we will look for further science, as Dr. Babu also said, as more and more people are getting vaccinated and those who had the disease are getting vaccinated, we look forward to studies both from the West as well as our own.
Right. Professor Babu, now the reason this is very important about how long the protection lasts is because, if we talk about our own vaccine drive, it's moving very, very slowly. We're hoping, the government has said by the end of the year that the adult population at least will be vaccinated. But then the worry is if there is this immunity erosion, then would it be that by the time we reach the end of the year, many people who got the vaccine earlier are again now susceptible to the disease and, perhaps we won't reach that herd immunity. Your view on that and why this is so important?
Yeah, I think that's a really great question. So now, those who are vaccinated are definitely protected because there's wide-ranging immune response that they'll have. And even these studies only show that doing vaccination, even if you're infected, is better. Whereas if you just look at those who are infected, it's not complete protection. And also, there is also the severity of the illness, which might lead them into, critical care and even in extreme cases, death. So the wrong lesson here is, okay, if you are infected and then get vaccinated, maybe then that's better. That's absolutely not the correct inference from these studies.
Right.
So in order to have population protection, we have to increase the speed of the vaccination. There's no doubt about it. You rightly stated in the beginning of your show, 8 million doses. My estimation say 10 million doses per day, at least to ensure that all the vulnerable are covered ahead of the next wave. That's what can guarantee us reduction in mortality and the critical care needs.
Right, and we're also still seeing cases of reinfection, Dr. Kucheria, even after the vaccine, people are getting infected. So that raises questions on this issue of immunity, though we do know that the vaccines that we have are, somewhat between 70 to 80% efficacious.
Right. Although we are seeing infections in those people who had the vaccine, I will say both from my own experience as a physician, as well as colleagues, as well as the data coming in from people who are doing on-ground current studies, the severity of the infection is much less. If you compare the two groups of people who had infection after the vaccine versus not, a much lower percentage of people are landing up in the hospital. That difference is marked, and that's one of the reasons to ramp up the vaccination drives and get the vaccine however, wherever one can.
Right, and Professor Babu, I was also talking about the reinfection, that many people who've had COVID, after a few months, again they've got it. So that is also something that many are worried about.
Yeah, Gagi, so the proportion of people who are having reinfection is not really great. In my own estimates and also talking to the other virologists, it will not be more than 10%. And mostly it is mild, especially in those who had asymptomatic in the first go. But more important point is, if we are speaking of infections, breakthrough infections in COVID after receiving the vaccine, the vaccines are tested against preventing death and severe illness. So therefore, some amount of breakthrough infections, if they are mild and don't require hospitalization, should not deter from getting vaccinated. So these are two different things. Proportion of reinfections we need to study really well to understand. On the other hand, breakthrough infections after vaccine are mild or asymptomatic. Therefore, vaccination case is even stronger.
All right. Well, we'll end this discussion here. Thank you for, shedding light on that. We'll slip into a short break and we'll be back and open it up to our viewers to call in with any questions that they may have. Stay with us. Welcome back. Well, it's time now for a viewer question segment. So if you have any questions about COVID and the vaccines, do call in on that number on your screens. We have our first caller, Justin from Delhi. Go ahead with your question.
My question was, when can the first dose of the vaccine be taken if already infected and came out of it? That is, I am negative.
All right, Dr. Kucheria.
So you have to wait about 12 weeks to get the first dose if you've had the infection.
Right, I think
to be on the, sorry, go ahead.
Yes, I think people, keep asking this because of the changing guidelines. So that's created a lot of confusion, even doubts in the minds of people. So if you could just tell us more about, this period between being infected with COVID and getting the vaccine.
So 12 weeks or about 3 months from the end of your isolation. So I wouldn't even count it the first day. There's not been much clarity on that date, but I am saying that, let's say you count to day 14. 12 weeks from that time, between the 12 and 14-week period, you can go ahead and get the vaccine.
All right. We have another caller, Nilima Verma, calling in. Go ahead with your question.
Yeah. Hello, ma'am.
Yes, go ahead.
Yeah, I got Covaxin. I got vaccinated on the 10th of April with Covaxin, and I got got COVID on the 19th of April. I became positive. Now, then I turned negative on the 6th of May. Now, when do I get my second dose of Covaxin?
Professor Babu?
Yeah, go ahead.
No, I'll let Dr. Rachna answer.
Okay. All right, go ahead.
I will admit that there's a bit of unclarity on Covaxin. The initial information after so I would count, let's say 4th or 5th May is your day one to get your vaccine. From that time we count forward. The initial recommendation was about 4 to 8 weeks. There has been some unclarity about have they extended also to 12 weeks or not. I would check in on the Ministry of Health website. Dr. Babu, if you have something to add.
Yeah, so according to the World Health Organization, they have said 6 months as the gap between the illness and the vaccination. Now, the government of India has also expanded the time after the illness to the, when you can receive vaccine dose. I would definitely this is already updated on the COVID-19 also. You will not be able to get it before that. So as Dr. Rachna clearly said, it has to be spaced after 3 months. So that's the evidence.
Right, and right now access to vaccines is such a big issue in many of the states. What can you tell us on how we hear that more vaccines are going to come? We do know Sputnik is there. Hopefully more vaccines will be approved soon, and we will get more deliveries. Are you hoping it's going to pick up in the next few weeks or maybe in a month or two? Professor Babu, first to you.
Yeah, so I'll have to be pragmatic. So while we are very optimistic about this, I don't think the scenario is going to change at least till July, because if you look at the supply line, currently whatever is happening, the government of India is sort of procuring and then giving it to the states, and states are still finding it difficult to get the access for now. But when you look at the vaccine supply line, by July, I think most of the stocks will be made available, and from August the pace can really increase. Till then, I only hope that all the states will improve the micro-planning process and so mobilization, so that people do turn up at the vaccination sites when the vaccines are available. At the same time, whichever vaccine, to whatever extent is available, they should be well utilized.
Right, and Dr. Kochhar, the worry now is also among people, who've had their first dose and now they're wondering and they're now getting due for their second dose and whether they'll get it. So this for Covishield, it's more flexible. It can be taken, a few weeks later. However, for Covaxin, it's more of a worry, isn't it?
I would say we need to get further clarity. In general, a 3-month mark, and I second Dr. Babu on saying that also on CDC and WHO, but they don't have CDC at least doesn't have data on Covaxin. So in general, the 3-month mark should be okay. But as I said, we need further clarity from Covaxin, from the Covaxin makers themselves. It was about 4 to 8 weeks, and I think then it was extended. So that clarity is needed before you go ahead and get your Covaxin shot.
All right, because we get a lot of questions regarding that with people now due, especially, the elderly now due for that second shot and it not being available. We have another caller.
Sorry, so just to add, I think 3-month mark from the time you had the infection is a good takeaway for either vaccine shot.
Right. No, I was also talking about the duration between the vaccine. So if somebody's had Covaxin, now they're due for their second Covaxin dose and it's not available and we don't know exactly when, it could take a little longer. That is a worry that we get from many people. We have a caller, DK Singh, calling from Muktsar, Punjab. Go ahead with your question. Right. DK Singh, please go ahead.
Yes.
Yes, go ahead.
Sure. What precautions should I take to avoid black fungus and sticks? Yes. What precautions should I take to avoid black fungus?
Do you want me to take
yes,
that?
Dr. Rachna, so this is the other big worry, of course. Everybody's worried post-COVID of getting the black fungus infection.
Right. So first, let me call it mucormycosis because there are all variety of color funguses now being spoken of. Also, I think takes off a bit of, one should fear it, but not in an inadvertent manner. Most importantly, if you have COVID, not taking medicines when they're not required is a very, very important thing. Please do feel free to ask your practitioner why you're being started on steroids if that's happening. If a medicine is a steroid, many times you may not know this, but you're started on steroids. So that is one big risk factor. If you're somebody who has diabetes and you were started on steroids and the sugars are not in control, that is the heady mix for this fungus. Other kinds of patients as well who are immune suppressed, and people know this usually if they have a condition which makes them a little bit low on immunity, autoimmune conditions, then they have to be careful and watch out too. And again, a lot of times we're seeing that people were put on steroids. There are a few cases that wasn't used. So the first thing, during the infection, be careful of the medication. After the COVID is over, be careful of any ENT type symptoms that you're getting that are persistent or worsening, then please be in touch with your doctor.
And contact your doctor immediately. Well, thank you so much, Professor Babu and Dr. Kochhar there for taking time out and answering all those questions for us.